Bismillahirrahmanirrahim. So we were basically discussing about the abnormalities of P wave, right? So this is the second part of abnormalities of P wave. So in the last video I have talked about the abnormalities up to the inverted P waves. So if we find inverted P waves in lead, so let me draw the leads here. So 1, 2, 3, right? Then we'll have AVR, AVL, and AVF, right? So V1 is here, V2, V3 is here, V4 is here, V5 is here, and V6 is here. So if we find inverted P waves in inferior leads 2, 3, and AVF, so we're gonna check the PR interval, right? So if PR interval is prolonged, so we're gonna say that the patient is having low atrial rhythm, also known as coronary sinus rhythm. If PR interval is less than 120 milliseconds, right? So we're gonna call it as AV junctional rhythm, right? AV junctional rhythm. If we find inverted P waves, right? So we have two differences of that. If we find inverted P waves in lead V1, in lead 1, so what could be the possibility of that? So we will have to check the QRS complex along with that. So if we check the P wave, so it is inverted, and along with that QRS complex is also inverted. So what we're gonna think, so we have to check AVR. The next step is to check the AVR. So in AVR, if we find that the QRS complex is facing upward, right, and we see the normal progression of R wave, like in V1 is small, there is small R wave, then we'll have the little bit large R wave, then we'll have more increased height of R wave, then V4 will be having more increased, and then R wave height is maximum, is of having maximum amplitude in V5, and then we'll have the this pattern is called as the normal progression of R wave. If we find this pattern, right, like if we find the inverted P wave in lead V1, lead 1, and AVR having positive deflection, and there is normal progression of R wave, so this condition is seen with the limb lead reversal, right? So this condition is seen with limb lead reversal. If we find opposite of that, like if we find, so let me erase this data from here. So if we find that there is a regression of R wave, that means we have the amplitude of R wave that is in decreasing trend, right? So you can see the amplitude is decreasing. So if it is like that, so we're gonna think, so you can see that amplitude is decreasing in pattern, right? Along with that, we have inverted P wave and QRS complex in lead 1, and positive QRS complex in lead AVR. So this condition is seen in dextrocardia, right? So we need to keep this in mind. Alright, so that's all about the dextrocardia and limb lead reversal. So the next thing is atrial tachycardia. Atrial tachycardia, right? So atrial tachycardia is seen in those conditions when the rhythm is not sinus, right? So when there is some other focus present in atria, right? So P wave shape will be dependent on that. So we won't find find any very fine P wave in these patients, and the rate will be more almost 120 to 200 beats per minute, right? So if we find that the shape of P wave is very different and rate is more, so we're going to call it as atrial tachycardia, right? The next condition is called as atrial flutter. So we're going to find the sawtooth appearance of P waves, right? So this is called as the atrial flutter, right? So when we find sawtooth appearance of P waves, right, so this is called as atrial flutter. And if we don't find any P wave, right, if there is no P wave, if there are just waves like that, so this is called as the F waves, fibrillatory waves, right? So this condition is seen in atrial fibrillation, right? atrial fibrillation. I'm going to talk about all of them in details when we talk about arrhythmias, right? So I'm going to discuss almost every abnormality what we are just naming here. So I'm going to discuss all of them in detail in arrhythmias section. So in atrial fibrillation, we're going to see the F waves, right? So there is another thing that if we see different morphologies of P wave, so you can see the P wave here, right? So then we'll have this QRS complex, then we have T wave, then we can see the P wave, another thing, right? So we're gonna check, this is T wave, then we can see the P wave, right? So if we find more than 3 morphologies of P wave, right? So if we find more than 3 morphologies of P wave, so there are two differences for that. It can be wandering atrial pacemaker or it can be multifocal atrial tachycardia, right? So how we're going to differentiate between these two? In wandering atrial pacemaker, right? So what we need to check that if rate, we need to check the rate in these patients. If rate is 100 beats per minute, right, and along with that we have more than 3 morphologies of P waves, right? So we're going to call it as wandering atrial pacemaker. And if rate is more than 100 beats per minute, right, and we're going to find the multiple morphologies of P waves, so this is called as multifocal atrial tachycardia, right? So in both of these conditions, we're going to find the variable PP interval, right, then RR interval and PR interval, right? So all of them will be variable, right? So that concludes our session on the abnormalities of P wave. So see you in the next video. That's all for today.